Zits, pimples, bumps, blemishes, no matter what you call them, the first thing you think of when they appear is how do you get rid of them? Joining us with the latest breakthroughs and recommendations for acne treatment is Dr. Susan Evans, Director of Dermatology from Cosmetic Physicians of Beverly Hills. Welcome, Dr. Evans. Great to see you again.
Thank you. It's good to see you.
So first of all, before we get into this conversation, let's talk a little bit about what causes acne, because there are so many myths out there.
You're absolutely right. And one of the biggest myths is that it's from uncleanliness, that you have dirty skin or something like that, and that you need to wash your skin more and scrub it.
So that's not true?
That's absolutely not true. It has nothing to do with cleanliness, and in fact, if you scrub your face too much, you can actually make it worse.
Oh, well, that's good to know, because I know lots of teenagers who get out the scrubbing brush and they try to just really get in there. Another myth, though, is that it's caused by what you eat.
People say they eat chocolate, they eat sweet things or sodas, and they break out. It's not true. Some of the hormones that cause acne actually make you crave those sort of things, so they seem associated, but that's not what does it. Scientific studies have shown it's not the diet.
No connection.
No.
Now, a lot of people also believe, though, there's nothing you can do about acne. You just have to let it run its course.
Which is so not the case, because if you do that, then you can actually scar and have problems. Do something to treat it. There's plenty of options for you. Don't just let it go.
So, Dr. Evans, if it's not caused by diet and it's not caused by, well, I mean, if we can't get rid of it by scrubbing and the rest of it, what actually causes acne?
There are four major things that cause it. Number one, there's a clogging of a pore, and that's usually done after there's a hormone excess. It makes the sebaceous gland make too much oil. In addition to that, it clogs up, it causes inflammation, and you get bacterial infections.
Is there any genetic component?
There is. There's a higher predominance in certain families. You know, if your mother had it, your father had it, an uncle, your brother or sister, you're more likely to form it.
Really? All right. Now, tell us quickly, what's the difference between adult acne and teenage acne?
Teenage acne is pretty common, and hopefully you don't have it, but if you do, you can deal with it. But adult acne seems really cruel, because you're starting to age, see yourself older, and then you also see acne. It just seems like a cruel twist of fate. A lot of times it's caused because people stop taking birth control pills, or they start using anti-aging things that cause acne. In addition to that, they could be using makeup with oil or some hair products that actually have a lot of oil in it.
Hairspray, for instance?
Hairspray is one, yeah, especially if you're wearing bangs, you're covering your forehead, has a lot of oil in it, and it's causing acne.
So you have to look for oil-free makeup?
Definitely.
Is there oil-free hairspray? I don't know.
Yeah, well, you can use hairspray that's actually hairspray that's not oil, or if you do, avoid your face and just get it on your hair.
Okay, very good to know. Now, what are some products that we should look out for if we're trying to treat acne?
Well, most of the things can be treated over the counter, honestly. If you have a mild acne or just sort of a monthly acne, you should just look for things that have these major ingredients in it. Benzoyl peroxide is proven. Dermatologists use it. It works. It can treat your acne. You have to make sure that you use a concentration that doesn't dry you out, but try that. You can see this in your drugstore aisles. Benzoyl peroxide is great. Sulfur is another great one. It also is very mild for the skin. It's great for people with rosacea or sort of redness associated with it. And another huge one is vitamin A in the form of retinol or retinoic acid. That's great. It's a revolutionary breakthrough. Alpha hydroxy acids in the form of glycolic acid or salicylic acid is another really important one. And retinol is the form of vitamin A that really makes a difference.
And there are some 3-step systems out there that you can just buy over the counter, right?
Clearly, there's so many out there, and they actually work, and they're simple. If you can put them into your program, you have just mild portions of benzoyl peroxide. It's a very common thing. 17 million Americans actually suffer from acne. It's really, I mean, all of us has had a zit at one point.
Absolutely.
And we found that 2.5% of benzoyl peroxide is really all that you need. You don't have to have these high concentrations that really dry you out.
And Dr. Evans, you brought along a patient with you. We're going to go over and say hi to Allie over here.
Sure.
She's been suffering from acne, and you have a new machine that can actually tell you where it's coming from and how to treat it?
Absolutely. This is the Vizia. It's the state-of-the-art technology. It has always been great for being able to predict things like age spots and lentigos. Now it's able to tell you what's going to happen with your skin from an acne standpoint.
And Allie, while you have your chin there, don't turn around and see me, but tell me a little bit how the acne has affected your life.
It's embarrassing, really. I'm a single mom of a 3-year-old boy with special needs, and I don't have time to worry about my skin.
Absolutely. All right.
Yeah, it's really hard on all of us. And so she's so great to come here without makeup, and we've taken pictures of her. We're able to classify her comedones, papules, and also some pustules, which are those sort of the big acne that comes to the surface, and then this is the fluorescent light that lets you see through the skin and sort of see the things that are coming to the surface. And as you see the different colors here, that you can see with a visible eye, and then there's other ones that are coming to the surface.
What are the green dots telling you?
They're telling you which areas have acne that are filled with something called porphyrins that is produced by bacteria, because after you get acne, then you get bacteria that harbor there.
And what are the blue dots?
The blue dots are actually showing you the pustules underneath the skin that will be coming to the surface. So this can allow you to predict it. You're getting married, you have a wedding, you want to know what's coming.
On the way.
Yeah, exactly.
So all
you want
of
to
this
prevent
tells
it.
you what? How will you treat Allie after looking at this?
Well, this is a way to classify how severe her acne is and follow her treatment. What is working, what isn't. What if we can see that it's clear underneath the skin, then we've really gotten rid of the problem.
Okay, great. Thank you so much, Dr.
Sure.
Evans and Allie. Thank you so much. Good luck with everything. And to check with a licensed medical practitioner to see what treatment is right for you, of course.